Hello, this is James Lowry with James Lowry Hypnotherapy, where I, with the help of a medical provider, aid adults suffering from immune disorders in relieving the emotional stress surrounding their discomfort in order to achieve a better quality of life in as little as one session. Today's frequently asked question is: how are immune disorders treated? Now, before I answer this question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. How are immune disorders treated? Now, in many cases, immune disorders are treated by managing the symptoms present within the condition. This often results in the use of anti inflammatory drugs, antibiotics, the provision of antibodies to those who are unable to produce them themselves, and in extreme cases, even stem cell transplantation. What is often overlooked are highly personalized adjunctive forms of treatment that focus on the underlying causes of dysregulation present within one's physical, mental, and emotional health, rather than focusing on just the symptomatic expressions of the condition. This is the difference between a normal, absolute, or sterilizing cure and a functional cure. Currently, there are no normal, absolute, or sterilizing cures for autoimmune disorders. Yet, a functional cure is one in which the disease is still present, yet there are no ongoing active symptoms for at least 12 months, and this is not owing itself to any type of medication. Functional cures of this type usually rely on forms of functional medicine, using holistic approaches to do, as I said before, treat the underlying causes within one's condition, which are present within one's physical, mental, and emotional health, again, rather than just the symptomatic expressions of the condition. So, with all of this being said, is there a form of treatment out there that focuses on and helps mend the dysregulation present between one's neurology and one's nervous and immune systems? There is. It is a branch of science known as psychoneuroimmunology, which studies how one's neurology and one's nervous and immune systems all interact with and affect one another. At the core of psychoneuroimmunology and its applications in the form of mind body therapies such as hypnotherapy is looking at where one's attention is placed, the degree to which that attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind body therapies such as hypnotherapy aim to therapeutically affect attention in this way to help people reestablish a healthy communication between their neurology and their nervous and immune systems. Now, you might be thinking to yourself, but James, I've tried talk therapies before and it didn't work for me. How is this different? Most therapies aim to alter or bolster your conscious perception of the problem. But if you could consciously decide right now not to have the discomfort you are experiencing, it would only be reasonable to assume that you would consciously do so. Would you not? If you could have consciously decided not to have taken on the problem, the condition, the discomfort at all, again, it would only be fair to assume that you would consciously have decided to do so already. So, the problem, the discomfort, and the maladaptive psycho-emotional responses that surround it do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious part of the mind. So, if you're looking to adopt this kind of therapy, one that focuses on the unconscious mind in such a way that helps you relieve the emotional stress surrounding your discomfort in order to achieve a better quality of life, in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.